channel. This is Isaac Chancroid. Kindly, if you have not subscribed to my channel, kindly subscribe now. Like and share. Also, do not forget to drop a comment. This is the channel that we usually talk about issues concerning averting HIV stigma in our society. And we usually say that being positive about HIV is not necessarily being HIV positive. And together, we can be able to avert the issue of HIV stigma and sexually transmitted infection stigma in our society. Thank you. Let us all be responsible of our own health, and let us all safeguard our own health by averting stigma in our society. Thank you. Let's all engage. In our topic today, we are going to discuss about a chancroid infection. Chancroid infection, this is usually a sexually transmitted infection that is usually caused by a highly infectious gram-negative facultative anaerobic bacteria that is usually called Haemophilus ducreyi. Now, how is this kind of infection transmitted? The transmission usually occurs when a healthy person gets a skin contact with an infective ulcer during sexual contact. Now, what's the kind of presentation or clinical presentation of someone who is suffering from chancroid infection? A person usually develops an ulcer on the genitalia that is usually necrotic and suppurative. This kind of ulcer is highly infectious, and the ulcer may develop, especially in male, it may develop on the glans penis or under the prepuce for the uncircumcised male. For the females, the ulcer may develop on the vulva or inside the vagina. Now, the other common presentation that is usually pathognomonic of chancroid infection is the swelling of the inguinal lymph nodes. An infected person usually develops a swollen inguinal lymph nodes that are usually suppurative or pus producing. Patient may also present with lower abdominal pain. Other nonspecific presentation, especially in female, they may present with pain during coitus and pain while passing urine. Thank you. Now, let's go to diagnosis. And before we go to diagnosis, kindly remember to subscribe, like, and share. If you have not yet subscribed to my channel, kindly subscribe. Thank you. Now, a diagnosis of chancroid infection is usually clinical in our healthcare facility settings. However, a diagnosis can also be confirmed using a culture. It can also be done using PCR, especially in research laboratories. Thank you. Now, let's go to the treatment. The treatment of choice for a chancroid infection is usually azithromycin. However, other drugs can be used like cephalosporins, the examples of ceftriaxone, quinolones, the likes of ciprofloxacin, and aminoglycosides, the likes of gentamicin. They are also effective. Now, let's go to the prevention. Remember, prevention is better than cure. Now, the best prevention that we are going to start with is treatment as prevention. If your partner is diagnosed with a chancroid infection, it's always very necessary for you both to be treated. Remember, you may be in your incubation period of chancroid infection, and getting treated before the disease emerges is also very necessary in this case. The other one is use of condom, although in this case it is not always effective. This is because the ulcer may not always be inside the vagina or on the glans penis. It may also be above the vulva. And in this case, condom cannot be able to protect you from getting infected with the infective ulcer. Are we together up to that point? The other one is risk reduction, especially if you're having multiple sexual partners. By reducing the number of your sexual partners, you are reducing the chances of you getting infected with chancroid infection and other sexually transmitted infections, including HIV, herpes, and gonorrhea. Thank you. I think this comes to the end of our topic today. Kindly, if you have any question or any kind of clarification you'd like us to explain further, kindly drop it in the comments. This is Isaac, Simple and Real. Thank you for tuning to my channel. Kindly subscribe if you have not yet subscribed to my channel. Thank you and God bless you. Bye bye.